I was in the process of developing a week-long talk that I gave in our community here in Dodgeville on evolution versus creation, which is no light topic for a man of science to give, because it was like refuting my entire education all in 5 days. So it was a pretty stress-packed week. And then at the end of that week, we decided it was time for a little leisure, so we were going to go out to Governor Dodge and have a picnic and go bicycle riding. Now, I hadn't ridden a bicycle for, I can't even remember the last time I'd ridden a bicycle, but we were going to do that. And then shortly into our bicycle ride is when I began to have this excruciating, severe, crushing chest pain that literally stopped me. I was in such physical distress.
And I saw him at the bottom of the hill, and I thought maybe he was having trouble with the bike. And so I asked, are you okay? And he said, he's holding his chest, and he said, go on, I'll be okay.
So I didn't want to be a alarmist, but as things transpired, I continued to decline in terms of, I began to lose my vision, and I began to get increasingly weak. I could feel cardiac heart rhythm disturbances in my pulse, and I realized that I was getting into deep trouble. So I went to use my own cell phone, and I couldn't see the dial on the cell phone. My vision had gone by that time. So I handed it to my wife, and she called the ambulance, and the ambulance was summoned to the scene. I was still in a state of denial, as is common for most men who are having life-threatening situations, is to think that it can't happen to them.
I immediately went to the window. You know, it could have been anybody, but this gentleman was so calm, and I just said, Mark's having a heart attack, I need some help. He didn't ask questions, he just acted. We didn't talk, we just moved, and we got up the trail, and Mark was, at that time, was on the ground, and we both picked him up and carried him to the vehicle.
We got the page for male subject with chest pain, just like a lot of our normal calls. So
when I heard that siren coming, that was a very significant sense of relief that I knew that help was on the way.
We got down to the park and seen a vehicle, and I seen Dr. Bishop, and I said, oh good, Dr. Bishop's out here. Oh, Dr. Bishop's the patient. Dang. And then it got chaotic and hectic, and we went into fast mode, and away we went.
I was frightened, very frightened, and very, very scared that he wasn't going to make it. I mean, the reality that this was really his heart. I guess them coming over and the nitroglycerin and all that, the reality hit me that it really was his heart. He started up the truck and went around the corner, and it wasn't 5 seconds. He went into arrest at that point.
Troy, stop! Let us see what we got here.
Gotta analyze. Stand clear, guys. Analyze it now. Shocking, shocking.
Dr. Bishop. What's your mind, doctor? I need to bag him. Here.
And I remember coming out of that shock, and I remember the attendants, Jan and Marcia, telling me what they had done, and I said, I know, I realized, I heard the whole thing in my ears, I know what happened.
He went out, we shocked him, we told Troy to get going again, we radioed the hospital, let them know that, you know, what we had, who it was, and that we'd shocked once already, so they could get ready for us as we got in. And all the doctors were waiting, and ER staff was waiting. I was doing CPR. I rode the cot in to the ER, and you gotta keep doing CPR. You know, I wasn't gonna let anyone else do it.
The EMT squad did an outstanding job of responding.
And as we know, that's what saves lives.
Fortunately for Dr. Bishop and for me too, Dr. Bruno was here, and Gary Bruno is really a superstar on cardiac resuscitation.
You know, and there was a lot of stress, a lot of going with staff. I don't know how many people were in the room, but there was a tremendous number of people which were showing up at that point in time that had been contacted and called. They brought him in, they put him on a cot in the room, and we continued to do CPR. We hooked up the monitors.
Was standing at the head of the bed He was seizuring at the time, and I'm thinking, if I can't get his mouth relaxed, this tube is never going to go in. And I just said a quick prayer. I said, God, I need, Mark obviously needs this tube in a very desperate way. And thank God I was able to get the tube on the first attempt. And they were then able to ventilate the lungs effectively with the ambu bag. And
I'd gone for over 8 minutes by this time without a heart rate and without a blood pressure. I mean, for all intents and purposes, that's the definition for death.
I think as we got him out of there and we knew that he had a rhythm and we knew that he had a pulse and we knew he had a blood pressure, nobody knew what the outcome was going to be.
They had already called for a helicopter. The helicopter arrived, and we transported Dr. Bishop out to the helicopter.
When I was being wheeled out to med-flight, it just seemed that everybody kind of spontaneously went with me on that gurney around me to support me on the way out there. And as the helicopter was leaving, everybody just spontaneously grabbed each other and hand in hand, and everybody that was out there just unified in prayer.
Jeff Pierce said, let's say a word of prayer for our brother. And so we grabbed hands and watched it go up. And but you know, as soon as everyone said, I mean, it was unison, everyone said amen. And then everybody watched. There was a calm that went over me that he was in his hands, and he was gonna be there when I got to Madison.
My philosophy has always been that it's imperative that every single small community have a hospital. It's nice to have super sophisticated technology, but you have to keep people alive in order to get them to that super sophisticated technology, as was the case in my situation. And there is an irreplaceable link in the chain of survival that is played by hospitals like Upland Hills. And if it's not adequately and continually supported by its community members, people in the community are going to suffer.